the state of our health, something we strive to improve and maintain, but sometimes inadvertently destroy. Universally, it's vitally important. The Germans have a universal word for it. Gesundheit.
Hello and welcome to the program. In this edition, we prove that grey power is alive and well. 95-year-old Ramaswamy Lakshmanan has earned himself a place in the Guinness Book of World Records as the oldest medical practitioner on the planet.
Researchers are preparing to implement greater security measures at germ storage facilities around the world in the wake of anthrax attacks. But they warn that a total clampdown would ultimately lead to far fewer medical breakthroughs.
And twin girls from Nepal, once fused at the head, have left Singapore for home after recovering from marathon separation surgery. Jamuna and Ganga will return to Singapore within a year or two so that surgeons can reconstruct their skulls. But our first story today deals with a 5-year, multi-million-dollar court battle. Bar Laboratories has started shipping boxes of fluoxetine, the generic version of the blockbuster antidepressant Prozac, taken by 2 million Americans every day. Bar Labs has 6 months to sell the 20-milligram generic capsules of fluoxetine exclusively, 25 to 40% cheaper than Prozac. The famous green and yellow pill generated $2.6 billion in sales in 2001 for Eli Lilly. Prozac is the biggest selling drug yet to lose its patent protection after an Indiana judge recently ruled in Bar Lab's favor. According to Dr. Stuart Schweitzer, professor of health economics at UCLA, there's little difference between Prozac and the generic copy. A Lilly spokesman said that the drug maker has been planning for years to lose its patent and is not likely to cut the price of Prozac. Lilly will try to make up lost profits with 2 new versions of Prozac set for release, including one that's taken weekly. Lilly plans to appeal the patent dispute to the US Supreme Court, but believe the High Court is unlikely to hear the case. Bar Laboratories, meanwhile, is quickly on its way to becoming the generic giant killers. A patient can spend thousands of dollars a year for the medication Prilosec, also known as Losec, which treats ulcers and acid reflux. But now, millions of patients are getting burned by Prilosec's maker, AstraZeneca. The company has filed lawsuits which delay the patent expiration on their multi-billion-dollar medication. When the patent expires, another company will be able to bring a cheaper, generic version of the drug onto the market. That, advocates say, would save the typical Prilosec user about $500 a year. Competition for patient and insurance company money is growing fierce. When Eli Lilly's patent on Prozac expired, the company lost 80% of its sales in a month to generic versions. Udrix Corporation is first in line to put a generic competitor for Prilosec on the market, and is expected to earn millions in its first 6 months. While Prilosec is expected to be the biggest drug patent expiration in history, more will come. Over the next 5 years, patents on almost $40 billion annual worth of drugs are due to expire. Sore throats account for as many as 10 million doctor's visits each year. According to a new study in the Journal of the American Medical Association, antibiotics, the most popular treatment prescribed for sore throats, is not necessarily the best one. According to the author of the study, Dr. Jeffrey Linder, most sore throats and colds are caused by viral infections which are impervious to antibiotics. Antibiotics are most effective at treating bacterial infections such as strep throat. Linders attributes the overprescription to expediency. Doctors not having enough time to perform bacterial tests or patients expecting a quick fix. Overprescription of antibiotics has allowed a new class of a drug-resistant bacteria to develop, which may be difficult to destroy and could lead to extended illness. Though it's yet to become a widespread health concern, emergency room doctors have already reported seeing an increase in drug-resistant pneumonia. In other drug news, Vioxx, one of the top-selling prescription painkillers, may increase a person's risk of having a heart attack, according to a study published in the latest issue of the Journal of the American Medical Association. The research looked at the rate of cardiovascular incidents such as heart attack, sudden death and stroke in 2 clinical trials and found that among people with rheumatoid arthritis, Vioxx may increase cardiovascular events twofold. Merck & Co., the makers of Vioxx, dispute the analysis. They conducted their own studies of Vioxx among 28,000 patients, in which some were given Vioxx and others were given a sugar pill. The drug, which is advertised as providing 24-hour relief to osteoarthritis sufferers, is widely used internationally and is currently being tested to see if it can prevent Alzheimer's disease in people with dementia. And the drug that's taken the world by storm. Young people everywhere have been swept off their feet by ecstasy. Once considered a harmless drug only taken by teens dancing the night away at raves and nightclubs, researchers now say they're sure ecstasy can cause brain damage and long-term memory loss. According to Dr. Alan Lechner of the National Institute on Drug Abuse, ecstasy use has spread to rural communities throughout the US and is not just a club drug anymore. Stamped with different markings like the yin and yang symbol and the Statue of Liberty, the pills are pouring into the US from Europe. In 2001 alone, United States customs agents seized over 9 million tablets and expect that number to rise sharply by 2002. As nightclubs pump out the music and kids come to dance, authorities around the world hope that ecstasy is just a passing fad, not an epidemic. "91-year-old Ruth has trouble walking, hearing and seeing. But with the help of 81-year-old Stella de Jauregui, the frail senior is able to get around safely. Stella is a volunteer for the Senior Companion Program in San Francisco. And like Stella, Fanny Putman volunteers her time to help others too. She heard about the foster grandparent program from a friend. Senior volunteers are obligated to work 20 hours per week, but they earn a tax-free stipend of $2.50 an hour. Inez, who's housebound, receives visits twice a week from Dorothy. While Dorothy does some practical things for Inez, mostly they provide one another with friendship. For these aging volunteers, work helps keep them feeling young, active and healthy. But when it comes to working well into the twilight years, one old boy takes the cake. He's 95-year-old Ramaswamy Lakshmanan, and his ability to carry on with his medical profession for the last 11 decades has earned him a place in the Guinness Book of World Records. Recognized by the Guinness Society recently, Lakshmanan is the oldest medical practitioner in the world today. Madras Medical College was his alma mater, and since his appointment in 1930 as head of pathology in the government hospital at Vellore, Lakshmanan has never stopped practicing. In many instances, he's even seen 4 or 5 generations of the same families, after delivering many of them to begin with. Dr. Lakshmanan's consultancy fee can at best be described as meagre, 2 cents for an adult patient and just 1 cent for children. He even includes the medicines for free, which he has an assistant dispense for him next door. The aging medic has no kind words for his fellow practitioners who charge exorbitant fees. According to a friend and neighbour, P.K. Ramamurthy, the good doctor can detect ailments just by looking at a patient's face. His methods are simple, but long queues of patients attest to his success.